Hi, this is Dr. Catherine Brown. I'm here to share a few tips on finding acupressure point stomach 38. The point is on the outer edge of the tibia or shin bone, and it's an equal distance between the medial malleolus or the ankle and the crease of the knee. And so the way I find this is I'll place my pinky on the ankle and my pinky at the level of the crease of the knee, and then extend my fingers out as far as I can until the thumbs are almost meeting, and then I find the point that is in the middle right there. And this point, there's going to be a bit of a dip, so if you gently run your finger on the outside edge of the tibia, so you're not right on the bone, you're just over the bone, you're going to find a little dip there that can be quite tender if you put a lot of pressure on that. I instruct my patients in clinic to apply the Earth Element AcuStick containing pure essential oils that activate stomach 38 and initiate the healing potential of this point 5 or 6 times per day. Now we're usually using this point for shoulder pain, and we'll actually apply the essential oils to the opposite leg. If my patients actually have time to apply pressure, they'll use a counterclockwise motion with heavy to medium pressure if there's inflammation in the shoulder. But if the shoulder is weak and it's an old injury, they'll use a clockwise motion on this point. And we often combine this with the metal element AcuStick being applied to points along the large intestine channel if that's the meridian that's affected with the shoulder pain. Details on using this point are located at Ageless Herbs on the acupressure directions page, and it will include different ailments and point combinations and all the diseases that this point will treat. You will also find tons of information about how to use acupressure and Chinese medicine for specific health concerns, and you can deepen your knowledge about Chinese medicine at agelessherbs.com. Thanks for watching my video. Likes are much appreciated, and please subscribe to my channel. Be well.